Good evening. My name is Andrea Joseph. My presentation will be a brief overview of my role as a nurse educator. This presentation will cover my philosophy of nursing, my current and future role as a nurse educator, my role as a change agent using the SWOT analysis, and my strategic plan for the future. Michael Knowles is best known for the development of the adult learning theory in 1984. He believed that adult learners are internally motivated, bring life experiences and knowledge into learning. They're goal oriented, practical, and like to be respected. Philosophy is a statement of beliefs and values. Billings and Halstead 2016. It guides one's actions, decisions, affects the assumption that we make about people or situations. Billings and Halstead 2016. To write one's philosophy, it's important for us to examine our belief, reflect on our values, think critically, and become self aware. I believe that education is the key to self improvement, development, and advancement to effect change. That's my philosophy. My current role as a nurse educator are being a role model, a facilitator of learning, and a change agent. The Institute of Medicine is calling for for nurses to practice at the full extent of their education. Nurses are admonished to change the healthcare system by focusing on evidence-based practices, serve as patient advocate, shape health policies, translate research into practice, develop skills in intra and interprofessional collaboration, demonstrate effective communication skills to promote collaboration and partnership with hospital-based and non-hospital-based patients. Nurse educator must also be able to re-examine the curriculum and integrate leadership competencies throughout. Halstead and Billings 2017. Due to the growing faculty and nurse shortage, educators must do their part by adapting to the changes in higher education. This can be done by understanding health information technology, apps, and other internet resources to reach a large number of mobile learners. Halstead and Billings 2017. A SWOT analysis is used to identify one's hidden strengths, weaknesses, opportunities, and threats. Barr and Dowdens 2016. The SWOT analysis is mostly used in leadership or in the creation of a professional portfolio. Educators can use this tool to clearly highlight their attributes and areas that need improvement. It is important for educators to identify their internal strengths, weaknesses, recognize the opportunities and threats. Educators must be able to identify how they can change threats to opportunities to bring about change within the classroom. The educator must have the following strengths: must have the qualifications, analytic competency, self efficacy, and have a useful tool to bring about change. Hall et al. 2016. In other words, the educator must be able to promote best practices by analyzing the current situation and use evidence based practice to implement change. In the same way, the educator can identify threats and weaknesses and improve these areas by engaging in continuous education. Halstead and Billings 2017. Nurse educators must be competent to facilitate, teach, and be a change agent in their role. According to the core competency by National League of Nurses, Nurse educators must be able to conduct self evaluation of their own performance, seek training to improve knowledge, and understand the national or state regulatory requirements. Currently, this right is practicing as a professional development specialist in the surgical services environment for the past 2 years and 5 months. As a certified nurse with 24 years of clinical experience in the operating room, I'm considered an expert OR nurse, but a novice professional development specialist or nurse educator. Due to the change in workforce and technology, educators must be prepared for the educational challenges within the academic world. Developing a strategic 5 year plan can be used as a guide for educators. When developing a 5 year plan, the goals, objectives, and actions with specific dates can help the educator stay focused. The goals must be achievable and realistic, and the objectives must be measurable. I graduated in 1995 with an associate degree in nursing. I've always wanted to pursue higher education. Therefore, I set my goals and my objectives. Although I took a long time to return to school, I completed my Bachelor's of Science in Nursing degree from American Sentinel University in 2015. At present, I'm enrolled in Herzing University pursuing a Master's of Science in Nursing with a specialization in nursing education. Currently, I'm working as a professional development specialist or a clinical educator for the Surgical Services Department. Upon graduation from Herzing University in September 2019, I plan to continue in my current role and become certified. I plan to pursue the National League of Nursing certification in Certified Academic Clinical Nurse Educator by September 2020. In the next 3 years, this writer plans to continue in my role as a clinical educator for staff development and pursue a role as an academic clinical instructor for a local college or university. In 5 years, this writer plans to um, develop, this writer plans to collaborate with a nursing residency developer of my current organization and develop a perioperative onboarding program. Currently, there is a huge shortage of perioperative nurses. Creating a pipeline through networking and education can create a pool of well trained professionals that can fill this gap. According to Halstead and Billings, nurturing a pipeline will foster partnership between colleges and their education institution. Currently, many of our specialty areas do not have an official onboarding program. Using the staff, usually the staff is assigned to a preceptor who was trained on the job, and that preceptor teaches what was taught to him or her. This results in a cultural practice where this is what the policy says, but we do it like this. This is known as the hidden curriculum. The hidden curriculum are verbal or nonverbal values and beliefs that are communicated during orientation that are not policy. Billings and Halstead 2017. This is not safe for our patients, whose care are becoming even more complex. Therefore, creating a formal program and partnership can increase knowledge, autonomy, confidence, and decrease adverse events and reduce length of stay for our patients. In conclusion, for nurse educators to be ready for the challenges of a changing healthcare requirements, evidence based practice, and new technologies, they must engage in continuous quality improvement, WHO 2016. That means that educators must be constantly learning and seeking out new learning opportunities. maintaining competencies, and professional development because this is an essential prerequisite in attaining high nursing practice standards. Thank you. Thank you for listening, and I hope you enjoy my presentation. Have a good evening.